Hi, everybody. We're going to go ahead and get started in just a moment. We're making sure that everybody joins on the hour here, and then I will welcome you to today's session. All right, we are just on the hour. Thank you so much for being here with us today. We are here for the Communication 101 for School Mental Health, Connecting with School Administrators session. This is part of our communication series. I'm Dr. Christina Borbay, and I am very excited to be here with the Southeast MHTTC. That's the Mental Health Technology Transfer Center funded by SAMHSA. The Southeast MHTTC is located at Rollins School of Public Health in Emory University and is serving 8 states in the Southeast, but today's session is open to all who want to join us. I want to say thank you to our Southeast MHTTC team, especially Sarah, and I think we have Josie joining us today also, as well as support from a number of other folks on the Emory University team. So thank you all. Today we are covering a number of topics that we heard from you are important to the work that you're doing in school mental health. And the reason that we're able to bring you these series of learning content is because of the evaluations that you complete at the end of each session. So for those of you who participated in these before, you know the drill. But for those of you who haven't, for all of you here today, it's so important for us to have your input. At the end of the session, we'll be dropping in the chat a link to a very brief survey. It means so much to us in order to be able to continue to bring you these learning opportunities. If you'll just take a couple minutes, and we'll make sure we leave some time at the end of the session for you to complete that feedback form. I do just want to be mindful of the fact we are a 90-minute session today. I know sometimes people need to drop off on the hour, and so we'll put the chat in the chat box. We'll add the evaluation link just before the hour in case some of you need to exit early, but we are a 90-minute session. So that's the plan for today. As I mentioned, my name is Dr. Christina Borbay, and I am very happy to be here with all of you doing this work in school mental health. It is something that I am passionate about. I've been participating in school mental health initiatives at the federal level for quite some time, including Project Aware as project director of that TA center, and now working directly with the Southeast MHTTC, as well as some other departments of mental health and departments of education to make sure that we are moving this work forward and making sure that there's access to school mental health for our youth. And I want to just let you know that we're all allies in this work. Sometimes it can feel really isolating. And so it's wonderful to be able to be here together with you and see all of you who are caring about this work. And so let's talk about some of the priorities that we're facing as we're doing this work. We heard from you that one of the challenges that you're facing is being able to communicate to school administrators, school leadership, key decision makers about the importance of school mental health. And so today we're going to focus on how to communicate kind of key messages and talking points around 3 key areas. One is, what is the importance of student mental health in academic achievement? We're going to cover some talking points around core concepts related to school and student mental health. And then we're also going to cover some key messages around funding considerations. So if you are a person who is making the case for school mental health to your school leadership, we'll be offering you some key messages and tools that you can use to connect the dots to what our school leadership cares about. I also want to acknowledge that we may have some school leadership with us here today. So thank you for joining, and you can consider this kind of your cheat sheet on what it is you need to know about school mental health, because we'll be presenting some of these kind of key elements that really drive how we think about school mental health initiatives from different stakeholders' perspectives. And that's kind of our second objective, is really being able to connect with each other about what are the common questions that come up, what are the issues and opportunities that we know are facing our leadership, and how can we bridge that for them? How can we be a support, a facilitator, a champion of school mental health in ways that really connect for our school leadership? So we'll have some opportunity for peer sharing towards the end of today's session. So let's talk through the order in which we're going to cover this. So first, I want to give you some content and talking points and tools around the value of school mental health, because oftentimes that's the case that we need to build. We're going to talk about some core concepts. Again, we can't make the assumption that everybody means the same thing when they say school mental health. And so I want to share with you some kind of common denominators that we can use to make that communication more efficient. And then oftentimes when we're talking to school leadership, one of the key topics that comes up is around fiscal strategies. And so I'm not doing a deep dive on any of these topics, but I am going to give you some tips and some hints and some tools for how to communicate effectively. We are also going to spend some time linking you to resources. So I'm not necessarily teaching to any of these topics. I'm teaching about the communication related to these topics. But we do have resources in all of these areas if you want to do a deeper dive. So that's our plan for today. I'm going to go ahead and kick us off and let you know if you want to add your name to the chat, please do. We are also going to be monitoring the chat. So if you have questions or comments or things that you'd like to share, please add that to the chat, and Sarah and Josie are going to help me monitor that. So let's go ahead and get started. The first thing that we're going to talk about is the value of school mental health. And I want to pause here and acknowledge that there probably, if you're here, you already recognize that there's value in mental health in schools. So I'm not going to be making the case for that, since I don't need to convince you. But what I do want to point out is that we often have to make this case, whether we have turnover in superintendents, whether we are having kind of different politics that we need to navigate, whether there's turnover in principals, assistant principals in our school. Being able to articulate, being able to effectively communicate the value of school mental health is going to be important to sustaining your school mental health programs and initiatives. So that's the first key point, is really being able to define what we're talking about. So just because you know the value, just because you know what you mean by school mental health, we can't assume that other folks are in the same boat. And so my first recommendation for communicating about the value is to define what we mean when we say mental health. And I've given this graphic here as an example, and I'm going to be making this recommendation again and again. Being able to capture these complex ideas in really simple and palatable formats is key to successful communication. And so making sure that when you are speaking with administrators, when you're speaking with school leadership, that we're all on the same page as what we mean by mental health is going to be critical. And oftentimes there's not recognition that mental health is a continuum. Oftentimes people default to thinking about mental health in terms of mental illness and not recognizing that there's a kind of a whole spectrum from illness to wellness. And we're going to talk about the dimensions of that in just a moment. But one of these kind of simple tools, graphic illustrations of the continuum of mental health, can be a really useful way to ground everybody in a universal sense that we all have mental health, that it fluctuates and is dynamic, just like our physical health. And that can really kind of get everybody on the same page and also move us more towards compassion and acceptance and away from stigma often associated with mental illness. The other piece when we're defining mental health that I wanted to bring forward is this idea that mental health doesn't mean one thing, it's multidimensional. So in addition to existing on a continuum, we can also think about mental health in terms of different definitions. So where we are on, if we have a disorder or a diagnosis or some sort of subclinical symptoms, as well as where we're doing, how we are doing with our mental well-being. And again, another simple tool here that just kind of maps out that mental health is not one kind of static thing. It's not a diagnosis, but it is an experience. And so thinking about how our young people as well as our adults on campus, are experiencing their mental health and wellness, can be a really important concept that we want our leadership to be aware of. So again, starting the conversation with some quick definitions of what we mean by mental health, that it's on a continuum, that it's dimensional, are key points to just ground everybody in the same conversation. I'm going to pause there and let folks know that we will have these slides available, and we will also have a recording of this session if you want to go back and do a deeper dive into any of these tools that I'm referencing. They'll be available to you. I'm going to go ahead and move us forward and offer some key talking points about school mental health. So this is kind of where we get into some of the nuts and bolts. And I don't need you to necessarily read everything that's on the slide in front of you, but what I want to do is anchor you in some key concepts. One is we often benefit from having evidence that what we're saying is actually the case. And so this is the quick overview of talking points from the research. So we are oftentimes champions, cheerleaders, and passionate advocates for school mental health and for our young people's wellness. And we can't assume that everybody has the same background that we do or has the same knowledge that we do. So how do we kind of make it a concise but evidence-driven conversation? And I'm going to walk us through kind of 3 different scenarios here. And this is all based on one meta-analysis of what the impact is of school-based mental health. And on this slide in particular, we're talking about universal mental health supports. Some folks might think about this in terms of tier 1. And so when we think about our tier 1, what is the value of having, for example, social emotional learning in schools? That's just one example, but any sort of universal mental health supports. Well, when we are talking to our administrators, we want to think about it from their point of view. What are the things that matter to them? They may be different than the things that matter to us. They may be different than our priorities. And so we want to really come at our communication thinking about who is our audience? Who are we delivering this message to? What do they connect with? What's going to land for them? And so oftentimes when we're thinking about school administration, school leadership, school policy decision makers, we're thinking about grades, we're thinking about test scores, and we're thinking about student behavior or classroom management. And so we have this research here that shows that universal mental health supports are associated with statistically significant improvements in these areas. So standardized tests, student grades, student level behavior, including long-term improvement in baseline externalizing behavior. So again, these are just a sampling of talking points that you may want to bring to your administrator. And I'm going to talk through, because of this meta-analysis really gives us some solid findings from across the board. I'm going to move us forward, still mostly in tier 1, but this is the research of the impacts of school-based prevention interventions. So again, mostly at tier 1, and we can see that in this case, we're connecting to another element. In addition to academic success, we're connecting to attendance, which can be another priority area that really will catch the attention of school leadership that we want to engage or talk with. And then I have 2 more areas. The next one is the research on impacts associated with interventions. So here we might be moving more into making the case for tier 2 or tier 3 types of supports and services. And we can see that having those supports available on school campuses are associated with some of those same things: changes in academic outcomes, changes in behavior, student behavior, and in students' experience of their mental health and wellness. And then for some of us, not all of us, but I want to acknowledge some of us are going to also be engaging with our school leadership around the systems or the frameworks or the models of school mental health. So not necessarily a specific program, but broader stroke initiatives. And so again, we have some talking points here about the value of having these kinds of systems or models or frameworks as kind of an organizational structure for how we are meeting the continuum and the dimensions of student mental health needs. Again, implementing these types of organizational structures for the programs and services are linked to some of these outcomes that we know our school leadership care about, which is disciplinary action and academic success. So in case you haven't picked up on it yet, I forgot to mention this at the beginning, but you can see in the top right corner here, we have a little symbol to indicate these are our talking points. So on any of the slides where you see this symbol, you know that these are talking points that you can use to engage with your leadership. But we also have a couple other things that we want to put forward to you, which are tools and deeper dive resources. So I'm going to move us forward to take a look at some of the tools that are going to be really helpful when we're talking to school administrators. And I promised you that I wouldn't stop making this recommendation, and I won't. You can see we have the symbol on the bottom left corner here for our little toolkit. And what I want to point out here are two things. So again, cannot make the case strongly enough for using infographics or visual guides to really connect what we're saying about some of these complex concepts to the audience that we want to connect with. And I have one example here. And the idea here is like, take a look. When you see this in front of you, you want to look more. What's going on with these figures and numbers? And so you can design your own if you have local data. There are often templates available where you can kind of plug in what your own statistics are. There's also kind of a range of data available, sometimes in infographic format and sometimes not. And so I wanted to point out, I particularly like this infographic because it's simple, it presents the information in kind of bite-sized chunks. The graphics themselves are pretty easy on the eye, so it's not super complicated or complex. It draws me in so I can understand more about what's happening and why it matters to students and their families in my school. But there are more updated sources of data that we're going to get to in the resource section. I wanted to highlight that some of these statistics are out of date and we have more current data, especially given the shifts that we've seen in student mental health since 2019. So again, this is just one example. I want to spend a little bit more time on our next example, another tool for communicating. And this tool can be used in a variety of different ways. We are going to, I see there's a question in the text about, are the graphics available? And the short answer is yes. We are going to start populating the chat with links to some of these resources so that you can access them. And I'll say more about that when we get to our resources page. The tool that I'm sharing with you now is also going to be made available to you. And we have done a number of learning opportunities or webinar sessions on this particular tool. We designed this at the Southeast MHTTC in response to your request to have tools to talk to teachers and school staff about school mental health. But this same tool can be used as kind of shorthand for letting school leadership know about how their school staff, how teachers and other school staff play a role in school mental health, even while they are primarily focused on their responsibility as educators. So this tool, again, I'm showing you the short form. We have it in long form where it kind of breaks apart each of these concepts. And this tool can be used in presentations. It can be used as a handout. It can be used on a website. And so we have a number of resources here that you can adapt for your particular school community. So it's a template. We have a usage guide that's available so that you can adapt this with examples that make sense for your school leadership, for your school district, depending on kind of what programs and strategies you have in place. But again, as you can see, it takes this really complex idea and makes it a more concise and palatable representation of what's actually happening. So when we think about what this means for administrators who are making decisions, they can recognize that school mental health isn't just happening in one resource room or at the counselor's office, but promoting student wellness and school mental health happens in our classrooms, it happens in our student services rooms, it happens campus-wide. And we can kind of think about what's everybody doing, what's everybody's role, and how do we support that in terms of leadership. What can our leadership do to make sure that folks feel supported in the work that they're doing for student wellness as well as academic success. So just as another highlight, this is an excerpt. So I mentioned there's a short form, which I was just showing you. This is a pullout of one element of our long form. And you can see this is at our tier 2 level. And it's what's happening in the classroom at tier 2 to give teachers some sense of what their participation can be in these types of supports. But it also shows them in the bottom right corner who their allies are. So again, making sure that our school community understands that we're all in this together. It's not all on one person, but it's a collective effort. So this tool can really help effectively either support people who know that this is true, but never saw it mapped out before. It can feel very affirming, or for people who don't recognize that they're part of this constellation and that we each play a role in supporting student wellness. Can be really effective. And it can also help our leadership in terms of means of talking about or making decisions about school mental health policy. So again, you'll see some of these tools popping up in the chat. Since this is one of our featured tools, I just wanted to let you know when you go to the landing page that is in the chat, the link is in the chat box, you can have access to the long form, the short form, a PowerPoint template of the long form if you're doing any presentations, as well as a design guide that will help you customize any of these tools with your own examples for your schools or school districts. The other piece I wanted to highlight for you that's available here is the resource compendium. And so this is a collection of visual graphics that you can use to support your communication strategies with a variety of people. But I'm mentioning this to you now because I'm going to reference this resource, this compendium, as we move forward into our next section. But before we move away from this key area of communication, which is defining school mental health, defining mental health in general, and the value of mental health in schools, that's what we covered in this main section. I wanted to highlight for you what are some deeper dive resources. And so you can see here we have in the top left corner our magnifying glass, and this is for folks who might want to learn more. And I want to highlight that any of these links that we're going to drop in the chat are available. But I wanted to know in particular the last two infographics that are from SAMHSA are linked to a website that is what is commonly called a group site. And you will, it's all available at no cost. But I wanted to highlight for you that there is, you enter your name and address and you'll be automatically approved. This is from SAMHSA's retired or sunsetted Project Aware TA Center. That closed, I think it was in 2019, but the resources are still available. So these are a lot of school mental health resources. All you need to do is enter your name and address and you'll get access to all of those resources that we created through that project. I'm the former project director, which is why I know about it. So I don't want you to think that we're like signing you up for any newsletters or there's no charge associated with it. That was just our agreement when SAMHSA closed that, that access would be through, would be kind of behind this wall where you just enter your name for approval. Any questions about that, just let me know. I am going to just check in with folks and see kind of how we're doing before we move into our next section, which is going to be about school mental health core concepts and how do we communicate about them. So Sarah, I'm going to see if we can pull up this polling question and get a sense from your perspective, what are the aspects of school mental health that are valuable? So what do you think our school administrators would say are going to be the most valuable about school mental health? So you can take a minute, you can select all that apply here, but we want to get a sense of what matters most to your school administrators. All right, so I definitely can see as the results are coming in that academic achievement and student behavior are in the lead here. Yes, so probably not a big surprise that those are going to be key issues. And so we're starting to kind of think about in our how we define mental health and how we communicate about the value of mental health, and using some of that research, using some of these tools to connect to these key pieces, right? Because we want to keep the attention of our school administrators. And so in this case, I'm seeing that folks are anticipating that there'll be less interested student morale. And so thinking about how we shape our message to connect to the things that matter to our administrators is going to make that communication more impactful, right? So as we are cutting to the chase, because oftentimes our school leaders don't have as much time as they would necessarily like. Oftentimes we don't have the kinds of time that we would like. Let's boil it down to what we know is going to matter to them. And from your point of view, academic achievement and student behavior, which might also kind of feed into discipline, are going to be key areas to drive home communication. This is why school mental health matters. This is why this program or this initiative is important to continue, is important to sustain. It's because it's going to help our students do better. It's going to help with their grades. It's going to help with test scores. It's going to help with academic achievement and competence in the classroom. It's going to help with what we see as externalizing or disruptive behaviors in the classroom. So thank you for that, Sarah. We're going to go ahead and move on. And if you could just, I'm just going to check in and make sure that we have folks muted. And then also, Sarah, if there's any questions or comments from the chat that it would be helpful for me to address now, will you let me know?
I think we're good for right now. Oh wait, somebody did just pop a question into the chat. That says student wellness was not included. Does that fall under student morale?
We didn't include all the possible things that matter in our polling question there, but we definitely know that student wellness matters in terms of our school mental health initiatives. And so weaving that into how we communicate to our school leadership is always an option, kind of making that case. And that kind of just gives us, again, some barometer, some touchstone for thinking about things from other stakeholders' perspectives. This is something that I fall into all the time, which is, well, twofold, because I get very excited about the topic of student wellness. Assuming that people know what I'm talking about, or that we're talking about the same thing, and assuming that people care about it or care about the same things that I care about when it comes to student wellness. And so as I've been practicing and refining the work that I do in communicating about school mental health with different audiences, I really kind of step back, take pause, and think about what matters to them, and how can I share it in ways that are going to make sense and build consensus. And so let's talk about that in terms of some of the school mental health core concepts. What I'm going to be doing now is kind of addressing some of the questions that might come up in terms of what are the key concepts, how do frameworks or models organize students, services, and systems, and what do school mental health programs and services even look like? So again, not making the assumption that people know what we're talking about when we say school mental health. So what I'd like to do now is just kind of run through a couple areas where we can make key points. And again, I'm really focused on giving you some of the communication tools and messaging more than I'm trying to teach to these particular concepts. And so the first one I want to talk about, or the first area that I want to talk about, are concepts around continuum of services, trauma responsive schools, and school climate. So certainly these are not comprehensive. These are not all of the concepts related to school mental health, but these are some of the key areas that might come up when you think about engaging school leadership or administrators. And so I'm just going to run through some of these talking points. Again, you'll have access to this archived recording, so don't feel like you have to track everything that I'm saying right now, but let's go ahead and talk about what we mean when we're talking about continuum of services. We'll talk about trauma-informed schools, and we'll talk about school climate. And so one of the key areas that I want to share with you as an example of how you can talk about these things includes information from the National Association of School Psychologists, who indicate that in many communities, schools are the largest de facto provider of mental health services. And in some rural districts, schools are the only source of mental health supports for children. We know that among children who receive mental health services, an estimated 70 to 80% of them initially get those services at school, and largely through special education, though not exclusively, as our initiatives shift over time. Schools as a primary access point makes sense because almost every community has schools. Children spend a good chunk of their day there, 6 hours or more a day. And adults in these schools have regular contact. So they are kind of monitoring what's going on with a child and can see changes over time, and help create kind of responsive relationships, develop trust, and make sure that they're connecting students to appropriate services. And so again, these key points around continuum of services, the value of these services being available in our schools are some of the key points that we want to be able to make to our school administrators. I'm going to move us forward to talk a little bit about what are the models of school mental health. And if you recall, in the previous section, we talked about the value, what is the impact of having a model or a framework versus having a singular program. So we'll talk about models or frameworks, and then we will talk about examples of programs and strategies. But kind of big picture level, what's the umbrella or what's the organizational infrastructure in which we are housing our programs and strategies? And we have some of these common examples listed here, and I'm going to just make quick talking points about each one. So oftentimes, and these vary from district to district, from school to school, we hear about MTSS or multi-tiered systems of support. We hear about PBIS or positive behavioral interventions and supports. Some communities are using a community school model. And then of course, a lot of times we're not just doing one thing. We're doing multiple or overlapping models. And so we'll talk quickly about that. I want to talk about MTSS. So multi-tiered systems of support. It's a framework for continuous improvement that is systemic, prevention focused, data informed, and provides a coherent continuum of supports responsive to meet the needs of all learners. So again, that's what that kind of tiered systems of support can look like. If you want a quick go-to image, you can take a look at the bottom left of the screen here. Again, kind of summarizing that key point into a simple graphic. And within the kind of overarching models of MTSS or multi-tiered systems of support, where we're looking at the tiers representing the different needs, the different levels of need, and how do we meet those with a continuum of services. Another model that is very common, and even if you're not using it, you're probably familiar with it at this point, is PBIS, and that's on the right side of your screen. The pyramid is the really common image to represent that. And so again, I'm not teaching to this, but I'm sharing this graphic as an example of a concise representation of a very complex concept. So don't try and read the fine print in there, but know that positive behavioral interventions and support is an evidence-based 3-tiered framework to improve and integrate all the data, systems, and practices that are affecting student outcomes every day, right? And so for administrators who might not be familiar with any of these models, being able to deliver kind of key talking points like, why does everyone keep talking about PBIS? Or what is MTSS and why are we doing it? Being able to make some of these key points and share some of these conceptual graphics will make those conversations go more smoothly and ensure that everybody's on the same page. Another kind of key piece that I want to make sure that we cover are around community schools. And so community schools are another model that's out there. You can go to communityschools.org if you want to learn more about it, but another method for creating an umbrella or an organizational structure around student supports and services. And so this strategy is aimed at disrupting poverty and addressing longstanding inequities. The approach highlights the areas of need and leverages community resources so students are healthy, prepared, and ready to succeed. And so there are kind of multiple stakes to this, but the key concept around the community schools model is that the school is the hub. The school is the hub for the student and the student's family for access to a full spectrum of supports or wraparound services, even not just around mental health and wellness, but more broadly around needs that they might be experiencing. And so again, I'm not covering all of the models here, but I just wanted to make sure that you have a sense of what are some of the key talking points and how do we make this concise and palatable for our leadership to understand, to get on the same page with, and then hopefully to support and advocate for. Before we move off of this though, I want to acknowledge that many of us are not doing one thing. So we have this kind of basic Venn diagram to indicate that a lot of times we have these overlapping systems. And one of the key models or frameworks that I mentioned before is around trauma responsive schools. And so I want to share a little bit more about that because it's different than our MTSS or PBIS, but you can integrate those concepts into your trauma responsive work. And so when we're talking to our administrators about trauma responsive schools, a key talking point might be something along the lines of a trauma sensitive school focuses on education that fosters school climate where students feel safe and confident in their ability to learn, can differentiate between trauma induced behavior and appropriate behavior, and connect with adults and peers in a positive manner. Right? So when we're kind of boiling it down, like what is a trauma responsive school and how does this connect to MTSS, making kind of short key points can be really important. The same thing when we're talking about school climate, because I know so many of our schools are engaged in positive school climate initiatives, and making sure that we have these key points to make to our administrators around school climate being based on patterns of students, parents, and school personnel's experience of school life that reflects the norms, goals, values, interpersonal relationships, teaching and learning practices, and organizational structure. So my kind of main piece that I'm advocating for is taking these really complex pieces and connecting them in a way that shows that they're not necessarily doing more things. They're just kind of a means to capture what's already happening. And using the graphic tools to make that a concise communication, to really ground someone, especially a visual learner, in what we're talking about can be really helpful. And these are some examples of integrated models you can see on the left here. And some of them are going to be available in the compendium of visual learning aids that I'm going to talk about shortly. But you can also just Google any of these and you'll find images available. You'll find background on any of these concepts. And of course, if you have questions about them, you can always put that in the chat and we can discuss. So this is a really dense section, but we're almost to the end. So hopefully you're sticking with me, and then I'll see if there's any questions in the chat. But before we kind of move off of this core concept, which is another bucket of communication, I want to share some talking points and some tools. So another kind of way that we relate to what's going on in school mental health is by talking about specific programs and strategies. Right. So now we're drilling down from these maybe more conceptual or theoretical frameworks to something that's really concrete, like what's happening every day. Like, why is this student getting pulled out of class? What is the program that we're using to navigate some of these challenges that we're seeing at tier 2? And so as you're building your toolkit, making sure that you have some awareness about kind of what might be on your school administrator's radar. We'll make sure that you're kind of connecting to things that feel familiar or feel known to them. And so you can see in the left side here, we have some concrete examples of what are we talking about when we're saying programs and strategies. And for easy reference, I color-coded these for PBIS as Tier 1, Tier 2, and Tier 3. If you're not using a PBIS model, you can ignore that part and just look at this kind of continuum of services and supports that might be available at any of your schools or districts that you want to promote, advocate for, sustain, or initiate. If you're making the case to bring in new programming or to build out your Tier 2 offerings, knowing about some of these programs and strategies can be really helpful. And what I have here on the left side, you can see I'm offering some talking points. I'm also offering some tools. And so I wanted to just highlight that we do have a handout from one of the other sessions in our Communication 101 series that really compiles a variety of graphics related to school mental health. And so we'll have that link available in the chat so that if you want to pull out any of the pieces that map onto the work that you're doing and get kind of an annotated guide for when and where to use those visual graphics, we have that available. And so that can help with kind of making those key points or talking points to our school administrators. But I'm also aware that we might want to go deeper on any of these topics. So I'm going to say it one more time, and then I probably won't say it again, maybe not, that I'm not teaching to these topics today, but teaching about what are the communication messages and what are the communication tools we can use to make sure those messages land. So I know we just covered a lot in terms of core concepts, but this wasn't a primer on the core concepts as much as it is, hey, your school leadership might not be familiar with any of these things. How are we going to define it? And how are we going to present it to them in ways that are going to be quick, that are going to make sense of some of those kind of overlapping elements and really simplify some of these complex concepts that we want to make sure that we're connecting about so that we can sustain the initiatives. So just like in the first section, in this section, we are also making sure to link you to some of the deeper dive resources. And so if you want to learn more about any of the topics that we covered today, if you want additional talking points, on any of these topics around school mental health, school climate, trauma-informed schools, multi-tiered systems of support, PBIS, the community schools model, and also taking a look at what are some of the state level strategies in place. We have these hyperlinks available and we will drop them in the chat. We didn't talk too much about this because I was really anticipating having an audience who is thinking about how to engage local education agency leadership. And so, but we do have this resource at the bottom here on state level strategies and what are some of the best practices. It's state level strategies if you're thinking about doing work at a regional level, if you're thinking about doing work at a state level, that talking to leadership about some of these strategies, this resource provides some really great overview of what that can look like. All right, so we're going to move on to our next. So we had 3 buckets. We've gone through 2 of our buckets in terms of what are key areas that we want to have communication messaging about as we're thinking about things from a school administrator perspective. Sarah, before I move on to funding and fiscal strategies, anything in the chat that you want to highlight for me?
Yeah, we had one participant ask, how can we involve the whole school in mental health awareness?
That's a great topic to get to before we talk about funding, because I'm going to bet that the whole school doesn't want to be involved in that conversation. And so I think some of the tools that we have covered so far in terms of using infographics to really make the case. And if we're thinking about our broader school staff, teachers, as well as other adults on campus, using our guide for, sorry about that, using the guide that I mentioned, and I'm going to back up to that example again. I think using this graphic tool for teachers really offers that kind of concise overview to get everybody on board for what their role is. And so to answer this question, I'm just going to spend a little bit more time on this excerpt from the long form tool. So the long form tool, just to give you an idea, basically takes each of these columns and each of these rows and breaks it out into an individual graphic. And so if we just are digging into this one example of what's happening in the classroom in tier 2, this helps everybody on campus understand where their role is. So it covers teachers and what they might be doing, school counselors and how they might be providing the teacher as well as the student support at this level, what the principal's role is, and in this example, there could be other folks on campus, other community-based partners like a school resource officer. And so using a tool like this to connect it to your school community in ways that are meaningful. So you might not have a school resource officer, but you might have a custodian at your school or custodial staff at your school, or the cafeteria staff or the bus drivers, any of the after school program coordinators. So again, kind of customizing it to think about who are the people that your school community involves and making the case for how they all are playing a role in lifting this up. And using the graphic tool this graphic tool that we put together can be a really good way to kind of make sense of it for everybody so that everybody sees how I show up for students is going to make a difference in their wellness, and how we show up for each other, how the adults show up for each other can help support these kind of collective shifts in school climate, in school wellness. And so I think that's a summary answer, but of course we could do a whole webinar on that session. Sarah, anything else while I move this closer to talking about funding strategies?
No, I think we're good to move on.
Thank you. Okay, so I want everyone to take a deep breath and exhale slowly. Not everybody enjoys talking about funding strategies. It can be a really stressful part of communication. However, if we are the champion, if we are the person carrying the baton forward when there's leadership change, or when we're building rapport and building support for ongoing or new programming, being able to say at least a few key things about funding is going to be critical. And so I wanted to build this into our communication package today. It's one bucket. And so this is kind of a soft entry. There's so many wonderful resources for folks who want to go deeper. But I did just want to kind of touch on some key elements here and address some of the questions around what are key factors that are relevant to school mental health funding opportunities, and what are key categories. So at least we have some familiarity with what are some of the key categories around school mental health funding. And this will help you be more prepared to have a more robust or kind of full conversation around school mental health with your leadership. So one of the things I am often hearing from leadership is don't just come at me with what you want, but come with solutions for how we can achieve it. And funding is going to be a key piece, whether this is sustaining funding, whether it's going after new funding, whether it's diversifying funding, just being able to touch on some of the key elements that your school administrators may or may not be aware of is going to be critical. So let's take a look at what that looks like. We're going to cover, we're going to kind of go into detail about talking points for these areas. First is what are our funding sources? So we're just going to cover three. We're going to talk about Department of Education, Medicaid reimbursement, and grants. So we'll cover some key talking points around that. And then we're also going to think about these things in terms of what are the topics that are likely to come up in any of these areas. And so just so that you're prepared, things that you might want to have a few talking points about include having needs-driven services. So thinking about what is the data that supports the type or level of need that students might be experiencing. Another area that might come up in terms of fiscal strategies is what is the duration or the reliability of funding? So that's something that leadership is often making a priority to care about. And then combination of funding sources. So what blends or braids? And then lastly, the infrastructure for funding access and implementation. So just because there's funding out there doesn't mean it's a good fit for the school or district that you're working in. And so helping leadership think through what is a good fit will be useful in your communication. So again, these are just kind of overview levels. It's not comprehensive, but at the end of this segment, I'll connect you to resources that provide a deeper dive into all of these. So I'm going to start with talking about school mental health funding at the Department of Education. Just check our timing. Before I jump into Department of Education, I do want to acknowledge that we're about 10 minutes from the hour. And so I'm hoping that everyone is going to stick around because we do have more to unpack together. But please make sure if you are leaving early to check the chat for our feedback survey. Again, that's going to allow us to continue to bring you these opportunities. Okay, let's go for it. So Department of Education. An example, so not exclusive, an example of this would be the Education and Secondary Education Act and Title I or Title IV funding. So these might be things that you're familiar with. They might be things that you've heard of but are not familiar with. Having some key talking points, or at least knowing that they exist, can be really important. So I want to just highlight that when we're approaching leadership, so when we're thinking about our school administrators and our school leadership, this is often the source of funding that they think of first when they're thinking about how to fund school mental health. So there are allotments for Title IV that cover prevention and intervention, and there are Title I funds that cover screening and services. And this is for both conventional education contexts as well as special education at tier. So we're thinking about this in terms of our Tier 1 and Tier 2 services and supports. And so again, when we want to build bridges and connect with people where they are so that we can move this forward in terms of sustainability or in terms of initiating school mental health programs, thinking about funding and thinking about, well, what is our leadership going to think about first? They're going to think about Department of Education funding. And so I wanted to highlight these for folks as kind of key areas to at least have some awareness of and how our leadership might be thinking about them. So again, oftentimes thinking about them in terms of covering Tier 1 and Tier 2 supports and services based on the Title IV and Title I funding. In our next topic, so we're kind of showing how these are not mutually exclusive categories of funding, because oftentimes we're pulling funding from all sources possible. So for our educational leadership, we're thinking about Department of Education. But I also wanted to highlight that Medicaid reimbursement is another kind of common funding source that we think about. And oftentimes, this is a slight differential, this is what our mental health providers think about first. And so if you're in a coordinator role, understanding kind of how different partners come to the table and what their go-to references can be really useful in navigating conversations. And so knowing that our mental health providers are often thinking about services and delivery of services in terms of Medicaid reimbursement is helpful when you're thinking, well, that's not how my superintendent is thinking. My superintendent isn't a mental health provider. They're thinking about Department of Ed funding. That can help you kind of be in a position to liaise and to serve as a translator between kind of two different perspectives or two different languages that might be spoken when we're thinking about how to resource our mental health initiatives in schools. But let me say a little bit more about Medicaid reimbursement. So for some folks, this might be a topic that you don't normally talk about. And so building some confidence and familiarity to make at least some basic points about it could be useful. Or you might want to drag in a colleague who is one of those people who just loves talking about Medicaid reimbursement. Through this source of funding, it will cover other types of services, although it's most often thought of for our tier 3 interventions. So just to kind of like put it out there, our mental health providers are often thinking about Medicaid for low income youth who are in need of intensive, individualized, usually clinical, but not always, interventions. So for us, in terms of school mental health, we might be kind of thinking about that in terms of tier 3 services. And so when we're thinking about how to talk about Medicaid reimbursement to our school administrators or our school leadership, it may be useful to frame this in the context of these are the students who are experiencing the most acute need. And if we're thinking about this in PBIS terms, it's the folks at the tip of the pyramid. So it's not all kids, it's a few kids who are experiencing the most acute need. Some key considerations, again, talking points for how to recognize where are our school administrators in navigating this and understanding some of the challenges or barriers that they might be sorting through as they're figuring out how to advocate or advance school mental health programming. For Medicaid reimbursement, we need to have access to providers who accept Medicaid. Well, first of all, you need to have access to providers, and then we need to have access to providers that actually accept Medicaid. And so that's a key consideration. We also want to think about it in terms of reliability. So once we are accessing Medicaid reimbursement, we know that this is reliable over time. Again, this is a differential from another source of funding like grant funding, for example, that might change over time. Another key piece that our administrators are going to be thinking about, and so having a couple talking points to acknowledge it would be useful, are the infrastructure requirements. So if your school community has infrastructure in place, it can, kind of the conversation is different than if you're considering Medicaid reimbursement. So the infrastructure requirements in order for schools to support the billing and privacy parameters for Medicaid reimbursement are fairly intensive, and it might be too complex for some schools to establish or maintain a Medicaid billing apparatus. And so that might preclude things like hiring providers through the school and might support things like partnering with community-based providers. So again, that's just some key areas where having some general awareness as an advocate for your school mental health initiative would be useful. There's much deeper information that I'm going to highlight for you when we get to our resources section. But before we get to that point, I want to go ahead and talk about our third bucket of funding. And that is grant-based funding. And we can think about that at the federal, state, or local level. And we have some examples here for you to consider. So the Substance Abuse and Mental Health Services Administration, our Project Aware is an example, and I know we have quite a few Project Aware grants within the Southeast region, but there are also kind of other types of grants available. We have the U.S. Department of Ed, for instance, offering some temporary types of grants that support student mental health. And so again, kind of thinking about what are the talking points around grant-based funding that we want to make sure that we have in our pocket as we are engaging school leadership. And so when we think about who's thinking about grants, some administrators are thinking about grants, others are not. When we're thinking about this category of funding, this is often considered a way to fill in gaps that are not met by the other sources of funding. So maybe needs or opportunities that are not met by Department of Education or Medicaid reimbursement. For example, opportunities to focus on specific populations. And so this can also provide, grant-based funding can also be kind of a more comprehensive or blanket funding across the continuum of needs. So for example, funding from grants could do something like fund a staff position to coordinate school mental health for a district or for a school. Other considerations that your school administrator or school leadership might be thinking about when you bring up or when the topic of grant-based funding comes up is the infrastructure is required, right? So someone has to write the grant, and writing good grants is a particular skill set or competency. And so thinking about whether that's a fit for your school or your school district is going to be key before you consider this. The other kind of consideration that comes up most often around grant-based funding for school mental health is the duration, right? So what is the timing or what is the cycle of the grant? And a lot of folks might be familiar with this as what we talk about in education, the shiny object, right? So thinking about a new program that comes and goes as a grant is implemented and then sunsets. And so oftentimes that can really influence people's willingness to commit or have buy-in, because it feels like programs come and go and there's not ongoing sustainability. And so being able to recognize these concerns and these considerations and these factors are going to help us come to the table with ideas and solutions for how to support consistent and comprehensive availability of school mental health programs and strategies. So that's a lot. I want to thank you for sticking with me to kind of cover those three main areas. And I know the funding one can feel a little bit clumsy and awkward if it's not a language that you're used to speaking. I will just say, in case it's helpful to any of you who are just getting your feet wet in this particular area of communication, it is not my area of expertise. And I work with a lot of colleagues, and I'm thankful for them, who have expertise and are very fluent in the language of fiscal strategies. But if you felt like I knew what I was talking about, I have like this much knowledge. I know school mental health is funding is so important. And so I try to stay versed in it so that when I'm engaging with school leadership, I can meet them where they are and talk about the things that matter with them and solution seek with them. And so hopefully that's encouraging of you to just kind of verse yourself a little bit in some of these key talking points so that you have them in your awareness and can use them in your toolkit as you're talking about that with your school leadership, who no doubt are going to have to consider what are the funding options for school mental health initiatives. So as I promised, we have a lot of deeper dive resources available on the topic of funding school mental health. These are just a handful that we put up here, and we'll put the links to these in the chat. But I wanted to make sure that you were aware that the Southeast MHTTC actually creates a lot of specialized resources and content around this topic. And so you're in a great place if you want to learn more. And these are some of the examples that might help you do a deeper dive or pull out resources that are going to be useful for your school leadership in navigating this aspect of school mental health. Okay, before we move on, we're going to do another check-in with everybody. But before we do that, Sarah, I just wanted to see if there were any questions or comments in the chat at this point.
Yes, one person asked, are there any assessment tools districts can use to inform a better understanding of the kind of infrastructure needed to bring in services, programs, etc., that are most successful?
There's a lot in that question. Could you read it to me one more time, Sarah? So I think we're looking at assessing infrastructure needs to support, to determine what are the best models or programs to use. Is that the distilled version of it?
Yes. So like any tools that districts can use to kind of help better.
Sure.
Yeah.
Yeah. And so I will first point you to the Southeast MHTTC resource library, because there are, and more broadly, the MHTTC resource library across all centers. We have a variety of resources around assessment and around doing essentially, I think what we're talking about here is a needs assessment. And so really kind of taking a look at not only what are the student-based needs for support, but what are the organizational infrastructure needs and resources. And so there are a number of tools in the resource library that can help kind of guide you through that process of taking a look at not only what the gaps are, but also looking at what's already in place and what else can be supported based on the infrastructure of the school. And so I don't have one to drop in the chat off the top of my head, but we will definitely make sure to follow up with the person who asked that question to link them to a specific set of resources. And if other folks are interested in that, we can include you in that follow-up email. But yes, there are a variety of tools, and I highly recommend that if that's not already in place in your school or district, that you can begin that conversation with your school administrators as a way to make sure that you're not, kind of picking the flavor of the week in terms of a mental health initiative or a program or a strategy, but rather you are engaging in data-driven kind of planning and then implementation of your school mental health initiatives. Okay, so we do have this kind of fourth bucket, which is really going to be driven based on what your interests and priorities are. So we covered the three main areas that are kind of universal in terms of conversation areas to make the case for school mental health with our school administrators. But there are many other topics that come up as well. And we don't have time to get into all of them today. But I wanted to invite you to go ahead and let us know. We're going to check in about what are some of the frequently asked questions or discussion topics that you feel like are facing your leadership. And so, Sarah, maybe we can go ahead and pull up the next polling questions and start with the first one. Let's see. What are priority issues that come up for or with your school leadership? So again, these are three common ones, and you can just select the ones, any of these that come up for you. But looking at compassion fatigue amongst our staff, looking at secondary trauma amongst our staff, or looking at morale or staffing turnover. So are these issues that you feel like are coming up for your school leadership? Let's see, I'm watching results come in, see who's participating. Yeah, it looks like compassion fatigue and morale and staffing are common issues. And then in our next section, what are priority frequently asked questions that come up for or with our school leadership? Social emotional learning, what it is and what it isn't, program fidelity, collaborations and partnerships, or equity and inclusion. Let's see if I can scroll down and see a little bit more here. Right. And so for those of you, we do probably have about 10 or 15 minutes to engage in conversation about this. And I think our two main areas are going to be around morale and staffing turnover, as well as checking in around social emotional learning and collaboration and partnerships. So all of these are kind of key topics that come up for folks. And so I want to spend a little bit of time just hearing from you all about how these play out in your school leadership conversations. So let's take a pause here. I'm going to stop the screen share just for a minute, Sarah, so that we can kind of have conversation about these key topics. Let me just make sure I got them. So morale and turnover, and then SEL, and then collabs. Okay. So I'm gonna, if folks wanna stretch, take a couple deep breaths, and then get ready to kind of share your own experiences. We're gonna talk about these for a minute before we wrap up our session. And we can, Sarah, if we haven't closed the poll, we can go ahead and share results and close the poll. So let's go ahead and talk about, again, these conversations that are coming up so often for us around what our school staff are experiencing in terms of compassion fatigue, secondary trauma, morale issues. And I know that this is an ongoing issue for our leadership, is even being able to recruit and retain staff. And so I wonder if anybody wants to unmute themselves and share experiences that they've had in this area and how they engage with their leadership to manage through these types of circumstances. I don't see anybody raising their hand or unmuting. I'm very comfortable with silence, but I also want to be mindful of your time. One of the key areas that I wanted to highlight, were actually a couple of things I wanted to highlight under this topic of how are we addressing staff morale. I know in the last couple years, there has been an enormous emphasis on investing in our staff wellness. And so that may be a conversation that feels really familiar to our school leadership. The Southeast MHTTC has a whole wellness series for our school staff that's available if you're looking for tools to either talk about why investment is important in our staff wellness, or if you're looking for actual resources to promote staff wellness. We have those available in our resource library. I also wanted to highlight that because this is a topic that's coming up again and again, we are actually going to be addressing it in an upcoming webinar in February. So be on the lookout for that announcement. I believe we're scheduled that for February 22nd, and we'll be talking specifically about how do we plan for staff turnover. But for today's session, kind of thinking about what are the communications or messaging with our school leadership around this topic of staff morale is really kind of the opportunity to think about it from that wellness lens, and thinking about when we're talking about school mental health. I think there's been more and more advocacy for thinking about everyone's mental health on campus. So really thinking about school mental health as an opportunity to serve students and staff by building trauma responsive schools, by increasing positive school climate. And so really kind of thinking about how to acknowledge that this is an ongoing challenge for folks, affirming that the reasons why this work can be really hard, it can be really taxing, it can be difficult to carve out opportunities for self-care when we're understaffed and there's so much on our plate. And so again, kind of thinking about how do we provide communication messaging that acknowledges what the issue is, but also links to opportunities and solutions. I'm going to pause there and just check the chat. I see we have some contributions on what are the strategies that are working to navigate or address this. Flexibility in schedules, open door communication, continuous support for daily issues, follow-up, encouragement, weekly team calls, planning gatherings, summers off, that's a good one. Just that opportunity to really to engage in kind of that restorative time. Just naming the one common challenge that comes up is defining the roles of community partners, especially clinicians and school employed counselors and social workers. Yes, Fran, thank you. Thank you for bringing that up. So the collaboration with community partners is definitely a key area that comes up. I want to remember, we're going to talk about this more in our February session, but I do want to remember to mention to you that there's a new study coming from South Carolina Department of Mental Health. Bob Stevens pointed it out to me. I don't, if you're interested in getting it, let us know in the chat and we'll follow up with you. I didn't get a direct link from Bob about what I can share or not share, but this is a study that really looks at what do our community-based providers need to feel like they can successfully provide services in schools. And so there's a top 10 list, top 10 recommendations, which include ongoing dialogue and preparation between our community-based providers and our school administrators. And so to the extent that you are a coordinator, that you can liaise between school administrators and community-based providers, help facilitate some of that or translate some of those language barriers or language gaps as we're kind of thinking about it from two different lenses or perspectives, can be really key to ensuring those successful collaborations. Thank you for bringing that up, Fran. And so I see Diane is asking for the staff wellness resources that we have. And I don't know, Sarah, if you are able to pull that link from the Southeast MHTTC Resource Library. Sorry to put you on the spot. If you can't find it, we can follow up. We can follow up with Diane. Okay, and I see we have requests coming in for that South Carolina study, so we'll follow up with you about that. And I want to just check in again if there are any other pieces around collaboration. I know that's been a big topic, and I want to mention it just briefly that we are kind of engaged in the field in these conversations to learn what's working and what's not working about around school and community-based partnerships to deliver school mental health services. So just so that you're aware, that's something that we are continuing to gather lessons learned about, continuing to refine, and we've found kind of a variety of different experiences. So we know that there's ongoing challenges with that collaboration. We also have a number of tools and resources that support best practices for that collaboration. And so again, kind of thinking about in the context of this particular session, how are we supporting effective communication? What tools are we using to make sure that when we talk about school mental health, when we talk about providing services, that we have shared language, and that we're building a shared culture. And so in your role, hopefully you can be kind of a bridge to some of that key messaging that's going to connect school leadership, teachers, families, with mental health providers, whether they're school-based or community-based partners. Okay, and let's see. I see, Martha, that you're asking specifically for tools around memos of understanding, and I'll follow up with you directly. There are templates available and resources available for creating those kinds of MOUs and contracts. So we do have that available. I also just wanted to, before we wrap up, and I'm going to switch us back to share screen in just a moment, I did just want to acknowledge that in terms of social emotional learning, I know that's a topic that comes up a lot with leadership in schools. And so I wanted to just highlight that there is kind of this opportunity to make sure that we mean the same thing when we say social emotional learning. There are a variety of tools out there, including some really great tools from North Carolina's Project Aware that really map out and demonstrate what are we talking about when we say social emotional learning. And I will just pause and say, you know, I worked with some communities in Georgia who were finding this kind of disconnect between what local school leadership and local leaders in general assumed social emotional learning meant, and what was actually happening in classrooms. And they gave these guided tours. They had a pancake breakfast and invited folks to come into the schools and see what their version of social emotional universal SEL looked like in schools. And it was really kind of this lovely experience of kind of reconciling what's the assumption and what's the reality. And there are a variety of ways that's happening. You don't have to bring people into the classroom, but there are lots of videos, including some really good ones from North Carolina Aware, that can be really illustrative of what we mean, so that when we're having a conversation about universal SEL, that we are all meaning the same things. And I want to also refer you back to our communication, our first session in our Communication 101 series, that really gets at how to build consensus in communication so that we are all supporting the thing that we care about, which is that our youth are well and that our youth are prepared to succeed. And so those are kind of 2 or 3 tools that I wanted to highlight for that particular topic. I'm going to go ahead and share screen again. And Sarah, I'm going to ask you to confirm that you can see the screen that I want you to see. So let's go ahead and share this. Oops, I think I probably need to, oh wait, are you able to see my notes, Sarah?
Yeah.
Okay, let's switch the display settings. Okay, so I'm going to move us forward towards conclusion. And I know that you've been seeing this pop up in your chat, but this is the time that I'm going to remind you again how very, very important it is that we get your feedback. Again, this is a really quick form to complete, and we ask you to do it now. We'll ask you to do it again in a little while. And that, again, is what we give back to our funder who's SAMHSA, the Substance Abuse and Mental Health Services Administration. They provide the funding for us to bring you these learning opportunities at no cost. In exchange, we are asking for your feedback on these forms. So please do take a couple minutes. We'll end a couple minutes early so that you have time carved out for this. And I also, so as you're clicking on that, I also wanted to highlight for you a couple upcoming sessions and what's available to you in past sessions. So there's ADHD and autism webinar coming up on February 15th, and I believe Sarah or Josie will put the link to that in the chat. And as I mentioned, I'm going to be leading a virtual workshop on school mental health staffing and turnover, because we heard loud and clear that that's an ongoing issue for folks. And so we want to put some tools into your hands for how to approach that and navigate it so that we can sustain the work even when we are not sustaining the staffing. So that's on February 22nd, and that will be announced shortly. We don't have registration for that open yet, but it's coming. And then I also wanted to identify for you some of our past sessions that are going to be useful in the context of this broader series on communication. So you already have the Communicating About School Mental Health landing page with all kinds of resources, including our graphic tool to communicate with teachers and school staff about school mental health. We also have the Communication 101, Engaging Adults on Campus Who Do Not Have a Mental Health Background. That's the series, that's the session that I was referencing that has some of those basic tools, basic best practices for building consensus around the topic of school mental health and student wellness. And then these last two links take you to the different pieces of our graphic tool on the role of teachers. So please go ahead and check out this entire series if you're interested. And I'm going to just stop here and see if there are any questions before we wrap up for today. And Sarah, if you could let me know if anything comes in the chat in terms of questions, that would be really helpful. I'm just running through the rest of our slides so you can see we actually do have our reference section available, but I'll go ahead and land us on this evaluation form page so that folks remember this is what we want you to do before you transition to what's next in your day.